So Amber, we're going to be doing your Halo BBL today.
Perfect.
And I just wanted to make sure that we're on the same page. I just want to understand what your concerns are about your skin first.
Great, yes. So being 38, I definitely have hyperpigmentation and sun damage over the years of just sun exposure, not using enough sunscreen when I was younger, but now being more proactive about it. So I'm definitely looking for a treatment that's going to decrease my redness, my capillaries, my brown spots, as well as tighten up pores and then reduce my fine lines and wrinkles. So I've started Botox this year as well, and I just feel like having the whole face treated will be so much better rather than just kind of my target areas. So really looking forward to kind of reducing a lot of the visibility of my brown spots and not having to wear as much makeup, and teaching fitness and being active. It's nice to just run out the door with your family and
Sure, not have to worry about it.
Yeah, exactly.
Did you find that after you had the kids, you know, after your pregnancies, that you developed more pigment in your skin?
Definitely.
Did you have a little pregnancy mask? Or?
Yeah, never really any melasma. I did live in Hawaii for 6 months before having kids, so I think that really did it for me. And then a lot of like the driver's side, you know, commuting on Oahu and traffic and things. So just not being as aware, I think, when I was younger. And then yeah, my skin was pretty good when I was pregnant, so I was really lucky there.
That's
but I
great.
know that that can definitely force more things to the surface.
It definitely can with the hormone changes in pregnancy and breastfeeding. And we see a lot of women that do have a pregnancy mask, and it's great that you don't.
Yes.
But in women that do, the Halo BBL can do really dramatic things to reduce the pregnancy mask. We've had some tremendous results with melasma as well. So I know we did a Visia just a few minutes ago and looked at that together, that computer analysis of your skin. And what really stands out is just what you're describing bothers you the most, the pigmentation. Especially, you've got a lot of deep pigmented sun damage, probably from, as you said, the years of not wearing sunblock when you were younger, and then living in Hawaii. Right, with all that UV exposure.
And here it's overcast and you don't think about it, right? But I'm like, nope, it's a daily thing now, sunscreen.
Yeah. So the good news is the Halo BBL is by far and away the best laser combination to treat exactly what your problems are, your concerns. You know, it's going to reduce your pigment, reduce the sun damage, tighten your skin, tighten and smooth your pores, tighten some of the fine lines and wrinkles. And we've been seeing really nice, just general firming everywhere. You know, we've had some patients that have had some really significant tightening of their jowls and the skin around the eyes and cheeks.
Wow.
It will also, since we're doing your neck, improve the texture on the neck and reduce some of the lines, along with the sun damage.
Yeah, I could see in the Visia the sun damage goes all the way down, so I'm sure my entire body could use a Visia and a Halo.
Right, I know. Halo really does work anywhere on the body. We've done arms, hands.
Oh my gosh, that's great. Back of the hands.
Shoulders, even someone's back. I mean, you can, anywhere you have those same problems of sun damage and brown spots and texture issues.
Perfect.
It works anywhere.
Okay, we'll plan to do the décolleté next round.
Yeah, that's right. That'll be the next round, yeah. I'm sure you'll do great and be happy with this.
Awesome.
Do you have any questions about the recovery?
No, everything was explained perfectly. I'm excited to try the serum at home that you guys gave me. So
the elastin?
Nice.
Yeah, it's a tremendous product. It makes the skin feel so good after Halo.
Okay.
Yeah.
Awesome.
So expect to be very red, like sunburn red for a few days.
Right.
Typically 1 to 5 days in there of redness.
Okay.
This feeling like you have a sunburn typically only lasts for about an hour after the procedure.
Perfect.
And then that'll go away. So it will be painless after that.
Okay.
You know? And beyond that, you may have a little swelling in the cheeks. Some people do, some don't. And you should be able to apply some makeup if you did want to go out after a couple of days.
Okay, great.
Yeah.
Wonderful.
Any questions?
Nope, I'm excited.
Okay, well, we're excited to do it. You're going to do awesome.
Thank you.
Yeah.